want to be proactive and you want to know, do you have prostate cancer? It's a real challenge today because we don't really have good tests that can assure us that if we have a positive test that we indeed have cancer, or if we have a negative test that we don't. And a lot of people are being overtreated. On the flip side of that, 190,000 people every year get prostate cancer diagnosed and about 30,000 people die. Not an insignificant number. Yet when you look at the number of people who actually have prostate cancer, it's far more than that. Because as we found out in our research, if you're 50 years old, your chances of having a prostate cancer are 50%. That's right, 50%. If you're 70 years old, it's 70%. And at age 90, it's 90%. So we're looking at an epidemic of prostate cancer, and the thing you need to know as a patient is only 1 or 2% of people who have prostate cancer actually die from it. So all the other people who find out they have prostate cancer are in a very terrible position. What do you do? Are you going to sit tight and say, well, I'll take my chances? Because only 1 or 2% of people who have prostate cancer diagnosed are going to die from it? Particularly those that have the more minor forms of it? Based on a biopsy, we give scores, they're called Gleason scores, to people who have prostate cancer. A score of 6 means it's pretty mild. You can watch and wait and see what happens. A score of 7, 8, or 9, or 10 is increasingly worse of a prognosis. And if you have a 7, 8, or 9, or 10, chances are you're going to want to do some kind of treatment. But most people don't have that. They have a 6. Now you've got the problem and you need to try and figure out what to do. The other thing is if a doctor does a rectal examination on you and you find that there's a lump or something that's not quite normal, or the gland is hard, like cancers often are, then you're going to biopsy it. And if you biopsy it, maybe you'll find the cancer, maybe you'll miss it. You can't be sure. So maybe you want to resort to the PSA test. It's called the prostate-specific antigen test, the one that Thomas Steamy discovered and told us about back in the 1980s, the late 80s. And at that time, we picked up a lot of people with very high PSAs, and we found those cancers, and we treated them. But what we found over the years is that if you have a PSA score that is between 4, which is the upper limit of normal, and about 15, your chances of having prostate cancer are only 50%. And we know that 25% of people who have a normal PSA score do have prostate cancer. So we've got a real problem here in reliability of our testing. There are some tests that can be done. There's a test that's done at the University of California, San Francisco, and a few other institutions that do something called an MRI with spectroscopy. That test is very, very good at telling what the whole gland looks like and whether or not the way that gland looks and the masses in it and the blood supply that they have are significant enough to be a cancer. Those results are pretty good, but the test is $5,800. And there's another technology that's coming up. A fellow named Dr. Robert Bard from New York is a radiologist there. And he's come up with a test that's called a 3D, 4D sonogram. That's a color Doppler, basically, that is about as accurate, but it's only $800. The problem is you have to pay to get there. And there are a couple of other places now that are beginning to do it. And those are in between steps that we need to do something about. But at the moment, we're really, for most people, stuck, because when we have a PSA that's abnormal, we're going to wind up doing an extra workup. You're going to have a biopsy probably. You may or may not find it. If you have a Gleason 6, you don't know what to do. So we have a decision problem of what do we do in that setting. Do you want surgery or radiation or androgen suppression? Do you want to just do watchful waiting and see if things change over the course of time? There are places for each of these treatments, and on other places on the site you'll find this information. That's one way to go about it. The other is to be proactive and to do something before you get prostate cancer. And now we go back to lifestyle. We need a diet, eat the right things, get those essential fatty acids, especially the omega-3s that are healthy, and those omega-6s that are not processed or refined, because they tend to increase the risk for getting prostate cancer. We should make sure that we have an alkaline diet so that our blood pH and cellular pH stays where it should be, so that we can be sure that our enzymes are going to be acting the best that they can and that we won't be at risk for developing cancers as easily. Lastly, the PSA and rectal exams wind up making too many diagnoses of Gleason 6 cancers, and we frankly overtreat most people. So what happens is you'll wind up running the risk of impotence, of complications of surgery, or of erectile dysfunction about a third of the time or more. So we have a long way to go in this era where the PSA testing is really over, and where the rectal exam is not that good, and where the biopsies miss too many cancers, and where we overdiagnose and overtreat too many people. So your best bet is do what you can to live a healthy lifestyle, and then consult with your healthcare practitioner. And depending on your family history, on your symptoms, things and how they presented, you may decide that you want to do advanced testing.